When we discuss the concerns of scoliosis surgery and what they could possibly affect the body, the first thing we have to understand is that scoliosis surgery, spinal fusion, is by definition a non-functional approach. They're exchanging function of the spine, which is mobility and flexibility, and they're exchanging that for better alignment. So they're sacrificing function for better alignment. It's not a functional treatment, meaning patients that perform spinal surgery will not have more abilities to function post-surgery. They won't have more abilities of their spine, more functional approaches. They're going to have less functional approaches. So by the very definition of this, we know when a patient goes spinal fusion, they're going to be limiting the function of their spine. And as a result of this, we don't have real good understanding of the long-term effects of removing this function from somebody's spine and what that equates to. We don't know what happens to patients 30, 40, 50, 60 years later as a result of this spinal fusion, and especially when considering these are kids that are receiving this type of surgery, 11, 12, 13, 14-year-old patients, and they're going to have a lifetime of dealing with spinal fusion and rods and screws in their spine, and we don't really understand these long-term effects. This is the most concerning thing with patients, and this is why I normally receive consultations and patients seeking out treatment when they're told they need spinal fusion. So most patients I treat are unfortunately surgical level, and we're trying to reduce them below surgical level so they can avoid spinal surgery and fusion. But those are really the big concerns that I feel most parents have.